All right, so now we're going to talk about Foley insertion. So at the hospital, at Midland Memorial, our policy states that you will do pericare immediately before the insertion of the Foley. It is a delegatable task, meaning as a nurse, I can delegate it to an intern, to a PCA, to another nurse. But if my patient develops a CAUTI, a catheter-acquired urinary tract infection, the hospital is tracking this. So if my patient develops the CAUTI, what happens is the nurses that have taken care of that patient for the 48 hours preceding the identification of the infection and the nurse that inserted the Foley, they go to peer support. Peer support is an educational opportunity in which they review your charting and review everything that you've done to kind of see, you know, what you've done, how bad was it, all of that. So it won't be the aide or the intern or the other nurse that goes to peer support, it will be you. So my feeling is, if I'm about to be in here in about 10 seconds in the perineal area, I might as well be the one that does the perineal care. So we're going to go ahead and we're first going to do Foley care. So I'm going to take off any watches, any rings, anything that when I'm going to go put on my sterile gloves that are going to potentially contaminate. We have right now, we have the bath wipes. So we're just going to go ahead and we're going to do pericare. You'll fill up your bag where it says to the water. There's three sponges in here, and you're going to use all three. So it doesn't matter to us, however you learned in school. Make sure that you're just giving it a really good clean, and you're going to use all three wipes. Even if the patient doesn't appear to be that dirty, you're going to use all three wipes. If it is a man, remember, you're pulling back that foreskin. If you are pulling back that foreskin, but in the Foley, you got to remember to replace the foreskin when you are done. You can't leave it pulled back because it will act like a tourniquet and cut off circulation. So I finished my pericare. I'm going to throw away my gloves. I'm going to do pericare, wash my hands. And now I'm back. So we're going to take our Foley kit. Now remember, I'm showing you how we do it at Midland Memorial Hospital. If you are doing this for school, you're going to do it however your school has taught you to do it. But at Midland Memorial, this is what we do. Our policy prefers that we open it in the bed. You can put your trash anywhere that you want to put your trash that you like, that's convenient for you. But you have to remember that wherever you put it, you need to make sure that when you're taking the dirty cotton balls back, that you are not violating your sterile field depending on where they are. So if you put the trash can in the end of the bed, that's perfectly fine. When you clean, you must trace the leg and then drop it in. You put the trash can on the floor here, that's fine, but you have to trace the leg to go. And one of the things that we see as issues are people are cleaning and they're going across their sterile field like this trying to get to the trash can. So put your trash can wherever it's going to be convenient for you, but you need to make sure you maintain sterility at the same time. So I put my tray in the bed, and now I'm going to go ahead and open it. It's important that only one hand goes into a sterile field at a time. You'll notice I am opening everything away from me. At the hospital, depending on the kit that you get, some of them have the soap and the drape here. Some of them have it inside the kit still. So this one has it on the outside because it's the more complicated one. We're going to show you it. It has soap, hand wipes, apparently if you haven't already done your hand hygiene gel, in case you haven't done your hand hygiene. I don't know why they offer you two different options. Now your drape is here. So you're not sterile at this time. I'm going to grab the drape by just the corner. I'm going to open it and let it fall open. Notice I'm not supermanning it. I'm not waving it around. I'm not making a giant show of this. It's just gentle tapping to go open. I'm going to, this corner is contaminated now. So whatever other corner I grab is also contaminated. Those two corners cannot touch my sterile field. So it doesn't matter to me which other corner you grab, make it convenient for you. If I grabbed this corner, then both of these corners are dirty. Therefore, the dirty side must go to the perineum. You cannot drag a dirty side into your sterile field here, okay? So you could grab this corner, you could reach around, you can grab this corner, it doesn't really matter, but whatever corner you grab, those two corners are going to the perineum. Now, I've grabbed my drape like this. Notice my tray is still closed. So if the drape is sitting on top, like it was when I opened it, this is where you're going to be really careful when you're opening. You cannot contaminate this drape, but I also have to finish opening this tray. So I've opened this up like this. I'm reaching in, I'm opening up that other flap so that now I can lay this drape down. Notice the two corners I've grabbed. I'm heading them towards the perineum, just like that, okay? I'm now gonna grab my gloves, and I'm gonna put my gloves on. When you're putting your gloves on, you cannot turn your back to the sterile field. So I can't turn like this to put my gloves on. I have to always be able to see my sterile field. So I'm gonna go ahead and put my gloves on. Notice this is why I've taken off my watch and my rings. I know that you'll see people that still wear their watches, but what we were finding at the hospital is that the smartwatches were heavy. So my sterile gloves might cover my smartwatch, but when I went to go drop my hands down, it would push on it and it would violate sterile. All right, open up my gloves. I know you all struggle with this. This is an absolute struggle for all of you. So just make sure when you're putting on your sterile gloves that a lot of you want to put your hand down like this to put on your glove. Don't do that. You always want to be facing upward, okay? So you're going to put this glove on. When you're putting on your second glove, a lot of you want to keep your thumb here, I guess, to brace the glove. Don't do that, because when this hand is sturdy, is coming close, you're going to get close to that sterile thumb. So move your thumb away, put on your other sterile glove. Get that flap up. Now I'm sterile. Now I can adjust this field so that it's where I want it to be, okay? Notice this corner, you probably can't see in the field, how it's fallen in. So it's now violated my sterile field. So what would I have to do in real life? In real life, I'd have to, this whole part is now contaminated. So in real life, I either have to cover it with this drape and make sure that it's covered. So that's what my plan is, okay? And of course, obviously in real life, my legs would be bent, so it probably would not have done that. But I'm going to take this drape. This drape, I'm now sterile. So to touch this drape, I want to make sure that my sterile gloves are always covered and protected. I know a lot of you want to grab the corners like this. Notice my hands are on the back side of the drape. If I did that and I went to go like this, can you still see my fingers? You can't. You can't see my fingers, you can't guarantee that they're sterile. So when you're putting this drape down, you're going to put your fingers in the front like this, and you're going to fold it over. And then you're going to cover your hands. I'm now going to go in, and I've now I have a sterile field from the top all the way down to the bottom. My contaminated part of my field is now covered, so I'm still good to continue on. Now I'm going to arrange my tray. You can put your tray, I like the cotton balls closest to the perineum, that way I'm not waving a dirty tong over top of my sterile field here. I have my Foley. So first thing I'm going to do, I'm going to remove my Foley from its bag. Notice how I've got control of it. I'm not just letting it flop around. I drop it down back into my kit here. My trash can's up there. I like my trash there because that way I'm not reaching across stuff. Notice I folded it in half. You guys, everybody tries to be all like basketball players. I fold it in half and I'm going to drop from above so my hand never gets near the trash can. I now have, this just has the sticks. So some of the kits will have cotton balls, some will have sticks. It's going to just vary on which kit you've opened up. If it's got cotton balls, you're going to pour the solution over the cotton balls. This one has sticks, so I'm going to open up my sticks and leave them sitting there. I'm going to take my cap off the water. I'm going to attach it to this port right here. Notice I am not checking my balloon. I'm not pre-inflating it to see if it works. We're under the assumption that it's always going to work. And what they have found is that best practices is you don't pre-inflate that balloon. When you pre-inflate the balloon to check it, what happens is that right now it's sucked down to factory standard. So when we go to insert there, so there's no bacteria that can get in there. If I pre-inflate it, to check to make sure the balloon's working okay. What happens is that when I suck it back down, I'm not sucking it back down to factory standards. So all the bacteria that's in that urethral tract gets trapped in all those little creases. I shove it up to the bladder, inflate the balloon, and now I've introduced bacteria up into the bladder. So we do not pre-inflate that balloon. I bought it all ready for me. I'm gonna take my jelly. Now, if this was, I'm taking the cap off. If this was a female, I would put my jelly in my tray. And then I'm going to, if this was a female, I'm going to lay this catheter somewhere because you guys all learn how you're going to loop it up. Notice how I have mine. I have it where my catheter is not coming close to where my sticks are. If this were cotton balls, I would do it exactly the same way because if I had tongs, I don't want to be reaching over that Foley every time I'm coming back with a dirty tong. If it's the sticks, I'm going to have the sticks leaning that way so I don't have to worry about it either. So my Foley's getting lubed up. Some of you learn in school to lube it up and then leave it back in your tray. That's perfectly fine. It's all sterile, so it doesn't matter, okay? This is a man, though. So because it's a man, all I've done, so for a female, lube in the tray, lubricate that Foley. For a man, what I'm doing is I've taken off the cap, tossed it in the trash, and I'm leaving my lube in its container, just leaving it there. Because once we clean for a man, we insert the lubrication straight into the penis. Okay, so now I'm going to go ahead and clean. So I'm going to grab the Foley, or I'm going to grab the meatus and separate them. I'm going to take one stick, go all the way around, drop it in there, grab another stick, again, all the way around. And then the third stick, or if you're doing cotton balls, however many cotton balls, the last cotton ball, the last stick, you always go straight over the meatus. We want to make sure that that is nice and clean. Notice when I'm throwing stuff in, my hand is way above the trash can. I'm not coming in here because I need to make sure I make a perfect basket. My hand's up here. It's far enough away from the trash can that I'm not getting close to it. Now, because it is a man, I'm going to take the lube and we'll put it straight into the penis and I'm going to inject. When you first do that, the head of the penis will swell. Once the lube starts to melt, the swelling will go down. The reason we do that with a man is that with a man, you're going to push this Foley all the way in to the bifurcation, so all the way down to here, okay? When you do that, if you just lubed a little bit in the tray, you basically are then just dry shoving that Foley straight up. Well, what was happening is that we were tearing up the urethral tract, and you'd always get a little bit of blood tinge, and we were tearing it up, so we were making a nice pathway for bacteria. So now with a man, we put the lube in there. Now this is where I know a lot of you want to just pull this Foley across the bed like this. Notice how my tray's coming with me. You're sterile. Grab the box, move it closer, and then and that way I'm not worried about where's my Foley, is it touching the leg? Because I'm paying attention to where the opening is, I'm not paying attention to where my Foley is. So if you move the box, then you're perfectly fine to be able to just, you're going to push it all the way up for a man, all the way up to the bifurcation. You're going to wait until you get urine back. Once you get urine back, we'll inflate the balloon. You're then going to take this, secure it to the leg. Notice our Foleys do have the nice little securement device on there. So you're going to attach it to the leg. And then you're going to get a urine. At the hospital, our policy states that we are going to get a urine with the very first insertion of a Foley. And the reason we do that is to make sure that the patient doesn't already have an infection, and we're not going to basically be staking claim to an infection that they came from home. That urine, and only that urine, you can get from the bag. Every other sequential, anything else that you need, any other urine, you will need to alcohol out the cap here, your sample port, alcohol it out before you put a syringe on there to grab your urine. One of the other things that you can do to help prevent CODIs is take the orange caps that we now have that we put on the end of IVs and put it on there as well, and that will help also prevent your infection. Thank you.